Medurstand. Understanding Medicine.
I'm Professor Aziz Rehman for Medurstand-Understanding Medicine. And I've already recorded lecture on hypothyroidism, but this one is particularly about a condition called subclinical hypothyroidism. What is it and how do we treat it? I think this short video will cover this concept. These are the normal values. Typically, when we do thyroid function test, we include these three values: total T3, total T4, and TSH. And on the basis of this, we make a diagnosis if the patient is normal or if the patient has got hypothyroidism or hyperthyroidism. Of course, a further question is if it is primary or secondary, but all these things have been covered in my previous lecture. And in this one, we will discuss just subclinical hypothyroidism. Now, what does this word mean? It of course means that this is a kind of hypothyroidism where values are low or some of the values are low, but it is still subclinical. That means it is not causing any symptoms. So typically you would have T3 within normal range and T4 also within normal range. They may be within the lower normal range or middle or upper, but they are within the normal range. That is the requirement for the definition. But TSH is elevated. Most assays, they use this range 0.4 to 4. Some use up to 4.5. So depending upon which assay you are using, you will apply the normal values. But if it is more than normal, but still less than 10, with the normal T3 and T4, this condition is described as subclinical hypothyroidism. Now, how to treat it? There is no definite consensus amongst healthcare professionals. Patients are even more confused. So I think I'll give you my view, which is based on American Thyroid Association recommendations. So first of all, assess clinically. If patient is symptomatic, then of course that would add point in favor of treating these patients. Now, what symptoms? Symptoms of hypothyroidism are usually very vague. So if you are convinced that these symptoms are coming from the thyroid, you could consider treatment. And age is also very important because younger patients, they tend to tolerate thyroxine much better than elderly. Elderly people may have concurrent cardiac disease and they may be prone to the side effects of thyroxine. So you have to be more careful if the patient is elderly, like more than 65. Then infertility. There are women who are trying to conceive, but if they're not able to, and one such factor could be subclinical hypothyroidism. And then pregnancy, of course, in pregnancy we are very, very particular. Actually, in pregnancy we need to adjust their thyroxine level according to semester specific TSH values. And then those who are having hyperlipidemia and they're prone to develop ischemic heart disease, and hypothyroidism can also contribute toward hyperlipidemia, so that may be also a consideration. Then existing atherosclerotic cardiovascular disease could be a reason. You actually assess all these and then make a judgment. You cannot make a decision on the basis of any one. So you also have to make decision with consultation with the patient. So you also like to do some further lab tests. In cases of subclinical hypothyroidism, don't jump to the treatment. Maybe you think about it more carefully and do some further tests. Since free T4 and free T3 are now available and they are more accurate indicator of thyroid status, I think you would like to repeat the test, maybe not immediately, maybe after 3 months, and then you do the free T4 and free T3. Along with that, I think I always recommend that you must do anti-TPO. Anti-TPO, as you can judge from the name, it is antibodies against thyroid peroxidase. Presence of antibodies would indicate an autoimmune phenomenon, perhaps indicating Hashimoto thyroiditis. Now, presence of antibodies would indicate even if patient is euthyroid or only subclinically hypothyroid, with time thyroid is likely to become more weak and patient is going to need treatment. So that point will also probably go in favor of starting treatment. So now the question, when to treat? First of all, I think the protocol is different for people under 65 compared to those who are more than 65. Symptomatic treatment, and you listen to the symptom. If you are convinced that the symptoms are consistent with the hypothyroidism like fatigue, lethargy, cold intolerance and things like that, I think you may give a trial of thyroxine. And particularly if anti-thyroid antibodies are positive. And if there is existing atherosclerotic cardiovascular disease, again, I think indication that's an indication of thyroxine. But if there is atherosclerotic cardiovascular disease, you have to have a very, very low start, maybe start with 25 mcg and gradually increase, very, very gradually, because these patients are very vulnerable to the side effects of thyroxine. Presence of hyperlipidemia will favor the treatment, and infertility, of course, there could be another cause of infertility, but since this is one treatable cause, even subclinical hypothyroidism people, they are treated with thyroxine. And we know thyroxine is extremely safe, and during pregnancy, it would be absolutely safe. Then if somebody is pregnant, then again, values of TSH above 4 would indicate thyroxine, because in pregnancy, we need absolute euthyroid state for the baby to develop normally. And if you are adult more than 65, then I think it is perhaps best policy to observe and do follow-up. Immediate thyroxine may not be needed here, and you do the test after 3 months, and you will be surprised that in some cases the thyroid function become normal in 3, just because there was some temporary problem and patient became normal, and then of course no treatment would be needed. But if the thyroid status has gone worse, then you might consider treatment. Then those patients who are already on thyroid medication, whether they are on thyroxine or they are on anti-thyroid drug, on them actually this concept of subclinical hypothyroidism does not apply. In all those patients who are already on medication, based on TSH, you will make adjustment in the medication. If TSH is high, that means they need to have slightly increment, some increment in their thyroxine. So when to treat if TSH is above 10 but T3 and T4 are still within normal limits? And this is technically again subclinical hypothyroidism. T3, T4, which actually indicate thyroid status, they are within the normal limits. So it is still subclinical hypothyroidism, but it is generally recommended that TSH more than 10, these people are at the verge of developing frank hypothyroidism, so they might as well be treated with thyroxine. So all such patients should be put on small doses of thyroxine. I think with this profile, I would start with 50 mcg, or maybe if somebody is 65 plus, maybe just 25 mcg. And of course, every 3 months, I would repeat TSH and will continue increasing the dose by 25 or 50 mcg till their TSH is 4 or less. With that, I'd like to thank you, and this was a short video, and I hope you find it useful. Thank you, Professor Aziz Rehman, for Medurstand-Understanding Medicine.